Good morning, Year 12. This is my third attempt to do this, so I'm really hoping that this goes smoothly. But what we're going to do is go through the second part of revising OCD. So last time in the first PowerPoint, you were looking at the characteristics of OCD, so the biological, the behavioural, the cognitive, the emotional, characteristics of OCD. And you were also going through the explanation, the biological explanation of OCD. So you were going through revising the genetic explanation and the neural explanation for OCD. So this time, for the second part, what this focuses on is the treatment of OCD. So that's the other area that you might get asked about if this is to come up in the exam, okay? So the treatment of OCD. So that's what we're going to focus on today. Now, the big thing to remember is that the main way of treating OCD, as you would expect, given that it's the biological approach, is to treat it through drug therapy. And the key thing that all the drugs do is that they increase or they decrease particular neurotransmitters. So often, like we'll see, that's serotonin, but not always. But pretty much all the drug therapies that they have for OCD, that we have for OCD, are about changing that level of neurotransmitter in the brain and then having an influence on behaviour. Okay, so that's the big thing to remember. So you'll see on the PowerPoint a diagram of a neuron, which is that big kind of teardropped shaped thing, and then the synapse, and then the next neuron, if you like. So the presynaptic neuron, the synapse itself, the gap between the two things, and then the postsynaptic neuron. And what we're going to do is just go through an explanation of what happens when we use the most common drug to influence the level of neurotransmitter of serotonin to try and alleviate the symptoms of OCD. Okay, so the biggest treatment we have for OCD is using an SSRI. So it's really important to learn and remember that an SSRI stands for a selective serotonin reuptake inhibitor. And you need to remember that term, not just because that's the name of the medication, but also because that tells you what the medication actually does, that it inhibits, it stops serotonin being taken back up, if you like, into the presynaptic neuron. And therefore, if you don't stop serotonin being taken up, it means that you have less serotonin in your synapse. And we'll talk about that in just a second. So after this lesson, not now, then what I would like you to do is go back to this PowerPoint, which I'll upload just as a PowerPoint in our normal files area, and watch the video that's about 3 minutes long that I've hyperlinked onto here that just goes through that process of neurotransmitters crossing the synapse. Okay, but for now we're just going to go through it ourselves. So first thing to remember is that serotonin kind of travels down the neuron, the presynaptic neuron. So that just means the first neuron, if you like, before you get to the synapse. So it gets to the end of the neuron. It's kind of carrying an impulse, a message that needs to go from the presynaptic neuron to the postsynaptic neuron. And then it goes into the synapse. But what normally happens, and you can see by the sort of yellow holy bits on the left-hand side of the diagram, is normally the serotonin would quite quickly get taken up again by that presynaptic neuron. So if you like it, to kind of suck it back in to the neuron in order to get it to go and do other jobs. But that would mean that there would be perhaps a low level of serotonin in the synapse. And if you don't have much serotonin in your body already, in your brain, and it gets taken back up into the presynaptic neuron like it normally would, then obviously you'll end up with a low amount of serotonin in your synapse. And serotonin is this key neurotransmitter that is linked into the regulation of mood. So what the drug does is it blocks those yellow sites, those bits where the serotonin can go back up into the neuron, and it stops that serotonin being reabsorbed. And therefore what you end up with is lots more serotonin in your synapse. And then that serotonin can carry over and over again, because it can just go kind of from one side of the synapse to the other. It can carry the impulses more quickly and more efficiently, because there's more of it, across the synapse and to the postsynaptic nerve. And that's what we need. We need more serotonin to carry more of that message. What that means, though, is that every time that serotonin gets to the postsynaptic neuron, so every time it crosses the synapse, which if we've stopped it being reabsorbed, it's going to do more, then it's actually, and this is the complicated bit, it's an inhibitory neurotransmitter. So you'll remember this from a couple of weeks ago from biopsychology. So what it then does is it decreases the charge of the postsynaptic neuron. So it makes it less likely that the postsynaptic neuron will fire. And actually that regulates our mood, regulates our behavior, and then helps correct some of the behaviors that are linked into OCD. So ironically, in a way, having more of serotonin in your synapse means that you always can more quickly and more frequently, if you like, calm down the postsynaptic neuron, stop it from firing more, because that's what serotonin does, it stops it from firing. So the more serotonin you've got going across that synapse, the more effectively it can stop your postsynaptic neuron from firing, and the better it can control mood and regulate everything and keep us calmer and less anxious. Now, I don't know if you can see that if I'm in the way, so I'm going to move my little self over here. It's very odd. Fluoxetine, which is actually commonly known as Prozac, you might have heard of that. If not, your parents will certainly have heard of that, because it became really, really common in the 90s, is the most common SSRI that is prescribed, but it does take a little while to kick in, and it doesn't work for everybody. So sometimes when SSRIs haven't worked, then other drugs are tried. Okay, so these are, on this PowerPoint slide, a list of some of the other drugs that are tried. Okay, so we have antipsychotic drugs. That sounds very frightening, but actually all they do is they act on another neurotransmitter, dopamine, and that can help OCD as well. So sometimes they're used. Often the first thing that's used after if an SSRI hasn't had an impact is what's called a tricyclic. And a tricyclic is just a sort of version 1 of an SSRI. It's an older style of antidepressant. But sometimes a tricyclic can have worse side effects for people than SSRIs. So that's why SSRIs are used first and tried first. Now, if tricyclics haven't worked, then they might try SNRIs. And again, you need to remember this. Now, that stands for serotonin noradrenaline reuptake inhibitor. Now, noradrenaline is actually, it's really complicated because it's both, sometimes it's a neurotransmitter, other times it's a hormone. So you've come across it in the fight and flight, sympathetic and parasympathetic nervous systems. I'm not a biologist, so I don't know the full reason for this, but it seems like even though it's prescribed, the SNRI, it's still the serotonin increase that is the key for people with OCD. So somehow, if SSRIs don't work, SNRIs might have the same effect, but it's still the key bit of that SNRI is the serotonin reuptake inhibitor. And then there are drugs called benzodiazepine, BZs, and they are anti-anxiety drugs. So you might have heard of things like Valium, diazepam, They are anti-anxiety drugs. And again, it's actually what they do with our neurotransmitters. Now, if you look at that information there, I've written down that BZs work by enhancing, making better, the action of the neurotransmitter GABA. And GABA has a really similar impact to serotonin. So it tells the neurons to slow down and stop firing, just like serotonin does. And it reduces anxiety, which, as we know, is one of the emotional characteristics of OCD, because people worry particularly about their obsessive thoughts. So that list there is a really useful list to know. But the key thing is, everything is about neurotransmitters and making a difference to particular neurotransmitters in our brain. Okay, so we know then that the treatment for OCD is very much focused on drug therapy. Here's some evidence that drug therapy is really effective. In this first study, you absolutely need to know. Okay, so Sumro et al. in 2008 looked at 17 studies where SSRIs had been given versus placebo treatment. So a placebo treatment, remember, is where you are taking some sort of what you think is medication, but actually it is a non-acting substance, but you are told it's a medication. So mentally, you know no different. It looked at 3,097 patients in total over the 17 studies. And the key finding is that Summa found that SSRIs were effective, especially when they were combined with CBT, and so cognitive behavior therapy. And in about 70% of patients, SSRIs had an impact on their symptoms, on lessening their symptoms. And for most other people, not everyone, but most other people, other drugs or a combination of drugs and CBT are usually effective. Okay, so that study is the really key study to learn and to remember and to be able to quote if you are evaluating the biological approach to treating OCD. There's also this one, Italian, I assume, Cicciarone, in 2000. He looked at a drug that basically lowered dopamine. So we looked at some of those antipsychotic drugs in the previous slide. So Cicciarone looked at whether or not giving those drugs for lowering dopamine, as opposed to lowering serotonin, was effective. And he found that it was, or she found that it was, actually, I don't know. Okay, so let's have a look at some of the other things you might need to consider when you start evaluating OCD and the biological approach to treating OCD. So all of the points on this slide need to be remembered, and you need to use them to actually help you evaluate the positives, the strengths and the weaknesses to the biological approach for treating OCD. So the first thing to think about is that drugs don't cure OCD, but they reduce thoughts, obsessive thoughts and compulsive behaviours, so that a normal level of life activities can be resumed. So nobody thinks that they are curative, but they manage symptoms. The medications, however, like SSRIs and tricyclics, might be more suitable for adults, because adults are just more able to understand side effects and whether or not that trade-off between side effects and impact is worth it. And also they're able to tolerate side effects. One of the really big positives of drug treatment is that they are quite cheap. They're quite cheap because although you have to pay for the drug, you don't have to pay for a therapist. You don't have to organise therapy sessions. You don't have a therapist time, and you don't have to go to therapy. So therefore, they're quite undisruptive, really, to the rest of your life if you're taking drugs. So they're seen as quite a good treatment from that perspective. The other problem is that CBT, cognitive behaviour therapy, which is acknowledged to be helpful alongside drug therapy, but it requires a patient to want to do it, to be motivated. So if you're doing CBT, you have to want to go to your session, you have to engage in your session, you have to practice the cognitive behaviour therapy techniques that you're taught. Drugs, however, are much less disruptive and you simply have to take them. So they are much better in terms of people who lack motivation to complete much sort of harder psychological treatments. However, they do have side effects, like we mentioned earlier, and some of them are quite mild and quite manageable, like indigestion, but others of them are much more serious and much more impactful in terms of your life and quality of life. So things like hallucinations, things like erection problems, and even just things like raised blood pressure, which might then cause a medical problem on its own. BZs, the drugs that we looked at for anti-anxiety like Valium and diazepam, are very, very addictive and have quite serious side effects, or can do. And so therefore they're only prescribed generally short term, and that can be a problem. And the whole issue of side effects can be a problem, because if you have side effects that are severe and nasty, you're much more likely to stop taking your medication and therefore to not have any benefit from that medication in managing your OCD symptoms. Some people argue that because there is a small risk of very severe side effects like suicidal thoughts, actually drugs shouldn't be used at all, that side effect is not worth the success that some people have with those drugs. And finally, although I'm not sure it is finally on my slide, we'll see, drug treatments are criticised because they don't treat the cause, like cognitive behaviour therapy might treat the cause of OCD. For example, thinking about environmental factors, when we looked at the causes of OCD, if you've had a traumatic life event, taking drugs is not going to change how you manage that life event. It might just change the symptoms you get, whereas cognitive behaviour therapy would do. So SSRIs will treat the symptoms by increasing the level of the neurotransmitter serotonin, but they won't do anything about what's causing the problem in the first place. No, I thought it wasn't finally. Just move myself right to the top. Furthermore, because they're only treating symptoms and they're not doing anything to address the underlying cause, if you stop taking your drugs, you are prone to relapsing, which suggests that something like cognitive behaviour therapy might be a better long-term solution. Also, this really should be a separate bullet point, I'm sorry about that, from the word some in the second line. Some researchers, and Goldacre looked at this, believe that because the research that says, oh, drugs are really effective, they help 70% of people, have been done generally by the drug companies that sell those drugs, the research is biased and is not reliable. So I'm just going to go back 1 second to this. So actually, all of these points will help you to evaluate whether or not the biological approach to treating OCD is an effective approach or not. Okay, so these will all help you with your Peel evaluations. Okay, so this is what I would like you to do now. I'm just going to pause the scene recording, but nothing will happen for you. So I'm just going to give you 2 minutes. And what I would like you to do in these 2 minutes is to write down one Peel paragraph which evaluates the approach to treating OCD. Okay, so in your Peel paragraph, you need to pick one of the points that we've just looked at. You need to make sure that you expand on it or add a little bit more. You need to think about some evidence, and then you need to link it back to why that suggests a strength or a weakness in the biological approach to treating OCD. So remember, it's quite helpful for that final sentence in your Peel paragraph to start it with the word therefore, so that you are really clearly linking it back. Okay. Well, I don't want you to look at that, which I've just managed to put up on the screen. So I'm just going to hopefully take it back in a second, but it doesn't appear to be doing that, which is there we go. So my daughter's laughing at me for being so hopeless. So I'm going to give you 2 minutes now, and I would like you to write your Peel paragraph, starting from now. Okay, you've got 1 more minute to keep writing your Peel paragraph. So keep going, 1 more minute. If you've finished, try and do another one. Okay, so I gave you just over 2 minutes then. I'm hoping that's long enough for you to have written a paragraph or most of a paragraph. So let's have a look at an example together now. So I'm just going to go on to the next slide so that you can see my P paragraph. And of course, now my PowerPoint appears to have frozen. So I'm just going to stop the share and then reshare in just 1 second. So I'm just going to share my screen again, okay, and hope that we can sort it this time. So let me just get back to the slide that we were on, and then hopefully we will be able to pick up from here. Okay, here we go. So here's an example Peel paragraph for you. So I've color-coded my sentences so you can see how I've built up the 4 different parts to the Peel paragraph. So I started off by making a really clear point that suggests that actually there is research that suggests that SSRIs are an effective treatment to alleviate the symptoms of OCD. So I'm starting obviously with the strength of this biological approach to treating OCD. Here's my evidence. So I'm remembering that Sumra study that we talked about earlier. So Sumra et al. 2009 reviewed 17 studies comparing the effectiveness of placebos when compared to SSRIs. In all cases, SSRIs were seen as more effective, suggesting they are a good treatment option for OCD. But I'm going to give a bit more detail here because actually I'm going to take my Peel paragraph in a bit of another direction to develop it further. So I've put, however, around 70% of patients reported an improvement in their symptoms, whereas 30% did not. This would suggest that they don't work for all patients and other treatments and different combinations of them are important. And I could even add another sentence on, couldn't I, that said, so this suggests to some extent SSRIs, or to a significant extent, they are an effective treatment, but not in all cases. Okay, so yours might have looked a little bit like that. You might have used a different point to back it up. Now, again, after you've watched this and finished this off, and we're not far off from the end now, then in the actual just plain PowerPoint, I've hyperlinked this second video in, which is a bit longer, about 7 minutes long, I think, and it just goes through the treatments for OCD. So once you finish this PowerPoint, go back in and watch those 2 videos just to hopefully consolidate your understanding of the treatment of OCD. Okay, now what I would also suggest that you do, and we're going to quickly flick through this now, but you can do it yourselves in proper time, is when you go back and look at this PowerPoint, stop on this slide. So you've got the question, which would be a normal 16 marker for the A-level paper, that says describe and evaluate the biological approach to treating OCD. So you'd need to go, wouldn't you, back to talking about treatments that are drug therapy based, that focus on changing the levels of neurotransmitters. Then you might talk about SSRIs, SNRIs, tricyclics, BZs, antipsychotic drugs, and then you start to evaluate them. So what I would suggest you do is have a go at answering that question, and then on there, and I'm going to flick past that really quickly, then you have got a example answer. I'll just show you that one more time to have a look at once you've done that question. Now, I've also just found this from a past paper. It's not a 16 marker, but it just asks you, this is revision, so this is going back to the first PowerPoint that we had about the explanations of OCD. So once you've done the rest of the work on the treatments, and you've watched the 2 videos, and you've done that previous question that I just flashed up, then see what you can remember from the first PowerPoint when we went through the genetic and the neural explanations for obsessive compulsive disorder. So this is your home learning for today, this week. So I'm going to set you some more when we move on to the revision tomorrow. But this is your home learning from this PowerPoint. I would like you to do me an 8-mark answer. So you're thinking, aren't you, perhaps, of doing maybe 2 peel paragraphs rather than the 4 you do for a 16 marker. Here is the mark scheme. So it doesn't give you any ideas and facts and things to put in your answer, but it does go through what would get you 7 or 8 marks, 5 or 6 marks, 3 or 4 marks, etc. So have a look at that mark scheme really carefully before you start your answer. Okay, so in a moment, I'm going to stop this recording, and that will be your revision for OCD. And I hope it's been really clear. Any problems that you have as a result of watching this, any questions that you still have, just put them in the chat and one of us will respond. Fantastic. Thank you very much. Hope that has been useful.